What does the process of repairing a rupture look like in the relationship? Does this take place in session? Does some of it take place outside of session?
Some of it takes place outside of session and more on the clinician side, right? Like I will self-reflect, I will process, I will take time rather than reacting, right? Making an initial judgment. And then I will more than likely seek consultation, right? Because ruptures more than likely feel uncomfortable for our patients. They also feel uncomfortable sometimes for us, right? Because we're here to help our patients the best we can. And so when there's discord, we want to repair, we want to fix because it sucks, right? To feel this way. And so outside work is us doing the work, right? Figuring out what came up for us, what do we suspect came up for the patient, how could we improve our behavior in that moment if improvements need to be made, and how can we broach the conversation during the next session, right? And seeking consultation if we want an outside unbiased perspective as well to make sure that our train of thought is correct. Um, and then in the actual session, I'm always bringing it up. If I feel like there's a rupture, I'm never gonna avoid just because of uncomfortability. It is our job to show our clients that they can give us feedback or express emotions to signify that something didn't land. And by us having those conversations, we're showing them that they can give feedback and that they could sit with the uncomfortability as well, right? It could be very therapeutic in nature.
Yeah, we might be the first relationship that clients have that can model what a healthy relationship looks like. And so ruptures are a really unique opportunity to be able to say that we could experience misunderstanding or whatever the rupture is related to, and still accept them and still want to improve on their relationship and still continue to work and help them serve their goals. So I think, like you had said, Thalia, getting that consultation, being very reflective, and then using the session space to really communicate what that means moving forward is helpful. Other components that I use generally is apologizing. So that could be a big one too. If you acknowledge it and you apologize, like, I'm sorry that, I misunderstood that. Help me understand, clarify that. Really simple. It doesn't have to be this, the whole session's focused on the rupture, but little things matter a lot.
Yeah, I agree with both of them for sure. And I really like Thalia's clarification of like the work that we can do outside a session. But depending on whoever was asking this question, kind of going to all the stuff we've talked about before, it shouldn't involve like the therapist crossing boundaries outside the session and calling to talk or sending messages, things like that. The therapist can and should do some reflection on their own outside of session, potentially seek consultation, and then address that during the next therapy session, as opposed to crossing boundaries outside of it.
And sometimes I may add, like there are moments that clinicians may not notice that a rupture has happened, right? It may be very small. You may be really good at like hiding your reactions to something. And so not that it is the patient's responsibility to always bring up these conversations or these difficult moments, but it's also an opportunity for clients to give feedback, right? Like we're human too. Sometimes we may misstep or we may say the wrong thing that doesn't land, right? And that's okay. Or like Jena was saying earlier, right? We may not be meeting our patient exactly where they're at, and that's where a rupture can happen, right? And that's that's good feedback for us. But it's not your responsibility to continuously give us that feedback. And hopefully ruptures are not a common thing. If they're a common thing within your with your clinician, that is definitely